Good evening, everyone, and welcome to today's wonderful session. Sankeet, Vikram, Rishabh, and many more who are all online and joining this wonderful evening. So, Spardaya Vardhathey Vidya, that is only when we are competing, when we are punching, boxing against each other, that edge to become competitive, the whole story begins. So, a lot of places you get the didactic video lectures, so much content today in the YouTube. But what motivates us is when we all meet, when we all fight, and when we take a set of questions as a quiz, and above all, the winner gets a cash prize. So that is the deal. So all the online students also, you have the quiz link with you. So you also please do compete, and you need to have the smartphone where you start punching the answers. And there are totally 75 questions. Every question you have 12 seconds time, which is available for you to answer. And the faster you answer, the greater and better will be the score. So that is the whole deal. Okay. So let's make the great beginning of the game. Um, One minute. Okay. I need to share the screen. Okay. I think this is good enough. Uh, yeah, great. Yes. So you're able to see the screen, doctor? Uh, Everybody? I mean, who are there in the stream? You're able to see the screen?
Yes, sir.
Yeah, great. So let's start the quiz. Yes, now the question begins. An ophthalmos is due to the paralysis of. You need to look into your smartphone and you need to punch your answer. An ophthalmos is due to the paralysis of. Is it levator palpebris superioris? Very good. We have the answer is superior tarsal muscle, which has a sympathetic innervation. But most of you have answered it as either LPS or as orbitalis, right? So, yes, doctor. Very good. But none of you could be able to answer it correctly. Very good to see 28 participants fighting the game. Wonderful. Now, the question number 2. Right gastroepiploic artery is a branch of splenic artery or celiac artery or gastroduodenal. Punch, 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 punch your answers. You know, only 12 seconds time. Great. 6 of you have correctly answered. It is the gastroduodenal artery, which is the right gastroepiploic artery is a branch of. Very good. Vishnu is on the top, and Shardul, SP, JJ, they're all, whoever answers fast will get the top score. Now comes the question number 3. Epigastric vessels in rectus sheath connect which branches of the aorta? You have the epigastric vessels in the rectus sheath. They connect which branches of the aorta? I'm really very happy to see 26 online students. Whoa! Only 3 of you correctly answered. It is the subclavian artery which is connected with the epigastric vessels is what you need to remember. And that makes JJ to be standing on the top. Now question number 4. So this is one of the favorite questions of the examiner. These are all the contents of the anatomical snuff box, except what? Anatomical snuff box. Great. Only 4 of you are right. You should remember, extensor pollicis. Pollex is your number. Extensor pollicis longus and brevis, scaphoid, radial artery. These are all the thing. Most of you have taught it scaphoid, but that's not the story, which forms the floor. And it is the adductor pollicis, which is not the content. So content versus boundaries and borders. You need to be very sure. Still JJ is on the top. Shikhar Mishra and Dr. Kaus, Sankirta, Sankit Kedja is has missed this, but anyway. Now, the next question, question number 5. Even if some new students have joined, they can still use this link. You can see on the top. You can use this link and log in, doctor. Regarding right ventricle, what is true? Right ventricle, what is true? Very good. It is the crista supraventricularis which directs the blood flow towards the pulmonary artery. That is what we need to remember. But majority of you thought tricuspid and pulmonary valves are in a fibrous continuity, but that is not true. So, Shikhar Mishra rightly answered. Saransh also, very good. Now, doctor, question number 6. Where will sperms learn to do the swimming? Capacitance of the sperms. What is the site where sperms finish their internship and get into post-graduation? Come on, punch your answers, doctor. Whoa! 10 of you are right. It is in the epididymis where the capacitance of the sperms takes place. A lot of people do this, commonly a mistake in the NEET PG exam. It is not seminiferous tubules, doctor. So JJ and Shikhar Mishra are maintaining their authority in this area. I'm really very happy to see 27 online students. Wonderful, doctor. Now, the next question, question number 7. Muscle spindle. What is its main function? This is such a favorite topic in the NEET PG exam. Is it the length or the tension? Length or the tension? You have to be 100% sure. Wow, that's good. Only 10 of you rightly answered, all of them. So we have Vishnu who correctly answered yes. What is the main function of spinocerebellar tract? What is spine? From the spine, what cerebellum need to get an information? The small brain cerebellum, what does it do by getting information? So this is one of the favorite areas, cerebellar physiology. Excellent. Cerebral cortex plans the motor activity, cerebellum smoothens the movement. Suppose you are walking into the fire. Your brain already thought that you should walk, but your spinal cord can feel the heat of the fire. It immediately told the cerebellum, hey, there is a fire there. So don't walk. So smoothening of the movement is basically for the spinocerebellar tract is what you need to remember. Wonderful, doctor. So did anybody? Wow. Sham, very good. Sham correctly answered. Dr. Kaus also correctly answered. Wonderful, wonderful, doctor. Question number 9. With regard to the absorption of the potassium in the gut, what is the wrong statement? Potassium absorption. How does potassium absorption? Is it an active transport or is it a passive diffusion? How much do normally people ingest? Very good. Normal people ingest 90 milliequivalents per day of potassium. It is by the diffusion that the potassium absorption occurs, whereas the potassium absorption in the large intestine is an active process. That is what you need to remember. And hyperaldosteronism, what does it do? So basically, aldosterone retains sodium, loses the potassium. Retains sodium, loses the potassium into the urine. That is what you need to emphatically remember. That's good, doctor. So, Saransh, rightly answered, 58. Lahari also. Very good. SM, Uma, and yeah. Now, question number 10. फीटल हीमोग्लोबिन को ऑक्सीजन के ऊपर प्यार होता है, ज्यादा प्यार होता है, क्यों होता है? Wonderful. 29 students are concurrently fighting. Who is going to be the winner of that 500 rupees when you top this today's quiz? Let us see. So that is very important. Basically, hemoglobin has two choices. Either I want to marry oxygen or I want to marry 2,3-DPG. If you have a mistress, the wife will leave you. If you love the wife, you don't need a mistress. So hemoglobin is like that. The middle-aged crisis to die. Either you be with that or this, but not both. So fetal hemoglobin does not have significant interaction with 2,3-DPG. That's the reason it has a great affinity for oxygen. It holds the oxygen with it. That is what you need to basically remember. Now the next question. Very good. We have 30 players online. Excellent, doctor. So Dr. Kaus correctly answered. Saransh correctly answered. Very good. Question number 11. Good cholesterol क्या होता है? I think all of you will crack it correctly. If you don't crack it, I'll give you free coaching in NEET PG exam. ये तो हर एक right answer करना है. Good cholesterol क्या होता है? Whoa! HDL is the good cholesterol. Very good. So nobody is innocent. All of you know that. Question number 12. This also, all of you should answer it correctly. Excess vitamin that lead to metabolic bone disease. Excess counts of vitamin, which is not vitamin D, that can lead to metabolic bone disease. I know all of you will correctly answer. Hypervitaminosis A lead to development of hyperostosis is what you need to remember. Very good. Yeah. Now, doctor, the next question. Good. Shikhar Mishra. Yes. Question number 13. Intracellular sorting and packing. How is it basically done, doctor? Intracellular sorting and packing कहाँ होता है? I think this is class 12 biology question. Yes. गोल्जी apparatus में होता है, एंडोप्लाज्मिक रेटिकुलम में नहीं होगा. That's good. Very good. Shikhar Mishra looks like ready to win the 500 rupees cash prize. But let us see. 75 questions are there. Somatic gene therapy. For which clinical condition was it given? Gene therapy. First time. Punch, punch, punch. Yay! That is right. It is the, can I get some water? ADA deficiency. Adenosine deaminase deficiency के लिए पहले बार जीन थेरेपी दिया गया. Question number 15. 1 ton of citric acid cycle में कितना NADH production होता है? 3, 6, 2, 4. This is the basic question for the tomorrow's NEET PG. Because without citric acid cycle, there is no question paper. 10 of you rightly answered. There are 3 NADH which have been produced, is what you need to remember. Very good, doctor. Now, so you pick up those topics where you are going wrong. That is the only way to become winner in the NEET PG exam. पहला आप किसमें स्ट्रॉन्ग है, किसमें वीक है, आपके मुट्ठी में रहना, then only you will become a topper. Please remember. खाली कोचिंग लेने से टॉपर बनेंगे नहीं बनेंगे, ज्यादा पढ़ने से टॉपर बनेंगे नहीं बनेंगे. Most important is out of 953 topics, where are you Superman? And what topics you really need to brush up quickly. So that is what the purpose of having a quiz tournament every day evening. At the same time, you meet all your friends across the country and try to learn how the competition looks like in the real time, right? Now, autoinfection is seen with cryptosporidium, absolutely. So, Saransh, Lahari, ABS are really doing great. Question number 17. These are all true statements. With regard to the primary immunodeficiency disorders. So, what is Chediak Higashi, what is Bruton, what is myeloperoxidase, and what is NADPH oxidase? You have to be very sure, doctor. Absolutely. Chediak Higashi, phagosome, lysosome cannot meet. That's a problem. Then myeloperoxidase is producing the hypochlorous acid. NADPH oxidase is acting via superoxide ions. Absolutely true. In the Bruton's gamma globulinemia, opsonization, it requires gamma globulins. That is very much affected. That's what you need to remember. Good. Shikhar Mishra, Lahari, and Vishnu are really doing good. Now, the question number 18. So, I think this should be a repeat question. Yeah. Gene therapy, out of all these 4 conditions, where do you use gene therapy? No. Gene therapy. Whoa. 10 of you write severe combined immunodeficiency. So Shikhar Mishra, Saransh, Lahari, SP are doing good, and even JJ and Shardul. Now, question number 19. Microaerophilic bacteria, I think easiest question on the planet. Which is a microaerophilic organism. I think all of you should answer it correctly. No big deal. Easy question. Yay! But only 10. Oh no. I was expecting all of you. See, Campylobacter, Helicobacter, ये सब चीजों को बोलते हैं microaerophilic bacteria. You need to get that list, right, in microbiology. Saransh and Lahari are doing really good. Now, question number 20. Gas gangrene kahan hota hai? It is due to all these organisms of the Clostridial species except gas gangrene. A really tough question to guess. Only 6 of you right. Except Clostridium sporogenes. Wow. SP and Shardul have rightly answered. Even Sankeet also. Very good, Sankeet. Now, 21. What is the intermediate host of Echinococcus granulosus? Echinococcus granulosus. What is the intermediate host? Great. वो तो बकरा है, हम उसका बकरा नहीं बनना. बकरा आंसर है. So, sheep is the intermediate host is what you need to remember. Intermediate host. Good. Yeah. Now, the next question. Good to see 31 online players. Tolazolin क्या होता है? Where do we use that? What is the mechanism of action? Tolazolin. So, absolutely, it is a vasodilator. It is one of the important vasodilator is what you need to remember. Good. Saransh is absolutely on the top. 23. Cetuximab, rituximab, all maps you should be good with. Where do we use cetuximab? Punch, 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 your answer, doctor. One monoclonal antibody के बिना question paper नहीं होगा. In head and neck cancer, cetuximab. If you have done this question wrong, today only you have to go back to the Incus app, download karo. Video library hai, 800 hours of video content is there. In that, in the pharmacology, we have wonderfully discussed the monoclonal immunoglobulins, monoclonal antibodies. You need to do a revision today itself. That's how every quiz, every day, evening, you should improve in your, you should identify what are the 5-10 topics where I'm really going wrong. That's the only job of the teacher. So, doctor, let's see, Shardul Shikhar Mishra, absolutely right. Question number 24. These are all the side effects of Emideron. Emideron के बारे में उनकी माँ कौन है, नाना कौन है, दादी कौन है, सब कुछ आपको मालूम होना चाहिए. Definitely आएगा Emideron. Come on, let me see. Whoa, it is not a productive cough. Doctor, Emideron lead to pulmonary fibrosis. In pulmonary fibrosis, you get more of a dry cough, not a productive cough. So, hepatic cirrhosis, corneal microdeposits, interstitial lung disease, they're all the side effects of the Emideron. So, Dr. Shardul SP, you are on the top. And even Vikram also correctly answered this question. Wonderful, doctor. Now, question number 25. Pharmacovigilance का मतलब क्या होता है? What does pharmacovigilance basically will do? Good, 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 good. Punch, punch, punch. Great. The whole purpose is to check the safety of the drug. Today in Andhra Pradesh, Anandaya medicine has become popular. You put few drops, people are getting up and walking, right? So now what we are doing, pharmacovigilance of Anandaya Ayurveda medicine about the possible adverse effects before endorsing it for the public usage. Question number 26. Which antiretroviral HIV drugs, they inhibit the microsomal enzymes, except which actually induces the P450 system? Come on, doctor. Lopinavir, ritonavir, sakinavir, efavirenz. Oh, 11 of you have correctly answered. Great. Very nice to see 33 online players. आपके दोस्तों को भी बोलना, भाई रोज 500 रुपए कमा सकते हम डॉक्टर मुरली भरद्वाज के साथ बेटिंग करके. Yeah. Now, question number 27. What is wrong about the anti-cancer antibiotics? Anti-cancer antibiotics. The best and most interesting way to prepare for entrance exam is सारे दोस्तों ऐसे बैठ के रोज लड़ने से सब्जेक्ट अध्ययन हो जाता है. स्पर्धया वर्धते विद्या. So anti-cancer antibiotics, it is the DNA intercalation, and mitomycin, vincristine, they're all used in combination. That's also true. But bleomycin-like agents are all cell cycle specific, is what you need to remember. Shardul, who is on the top, has already earned a lot of points. Sankeet Kedia is quickly racing. Very good. Question number 28. About histiocytosis. So, there are different types of histiocytosis. Recently, we had a evening session, radiology session, right? So, please go through that list. Very good. It is most common below 3 years of age. Disseminated form of histiocytosis को बोलते हैं leptomeningeal Suvi disease. And also histiocytosis, there can be diabetes insipidus. There is a eosinophilic granuloma, lateral Suvi disease. You have to be 100% sure. Beerbeck granules on electron microscopy भूलना नहीं. जिंदगी में कभी भी histiocytosis आप नहीं देखोगे, मगर entrance के लिए it is very important. Good. Lahari is on the top. Very good. Saransh, SP, Lahari are really doing great. Lahari is quickly coming to capture Shardul. Now, question number 29. Patch test, prick test. You should know anything, everything about it. What is it mediated by? Is it type 1, type 2, type 3, type 4? What do you like to call that as? A lot of people have a confusion on this. Very good. It's a type 4 hypersensitivity. Delayed type of hypersensitivity is the patch test. Very good, doctor. Whoa! Shardul is not going to give chance to Lahari and SP and Saransh. So, question number 30. Macronodular regenerative changes. So, you should know micronodular, macronodular. What are the causes here? Causes there. वो लिस्ट तो आपके मुट्ठी में रहना है कल के नीट पीसी के लिए. Macronodular regenerative changes. Wow. Viral hepatitis B is what you need to remember. So, Saransh is once more right. Both Lahari, Shardul or clean board. Question number 31. Metastatic dystrophic, two types of calcification. And where does it happen? What is metastatic? Option A, option B, both clearly differentiates. Yes. Whoa. Metastatic calcification occurs whenever there is excessive level of serum calcium, all hypercalcemic conditions. How can 8 of you can go wrong like this? And जो डेड टिश्यू में होता है वो डिस्ट्रोफिक कैल्सिफिकेशन होता है, but it starts in mitochondria. That's what you need to remember. Whoa! Shardul and Saransh, punch, 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 punch. Right? Let's see. Question number 32. Still, you have 40 points more to still become a winner. Last moment में. Papillary necrosis में, what are the radiological signs? Except great. Egg in spoon, ring shadows, lobster's claw sign, they're all papillary necrosis classical radiological signs. There's a splaying and widening of the calyces. Good. Most of you were clean bold. Kirtana. Very good. Correctly answered. And yes. Good. So question number 33. AFP is increased in all this except alpha-fetoprotein is increased in all these conditions except. Easy question, very easy to guess by elimination. Whoa! Not in renal cell carcinoma. Very good. Saransh is right. Sankirt also clean board. Shikhar Mishra is also right. Great. Now, question number 34. Suppositous child कौन होता है? Basic question in forensic. Suppositous child. So, doctor, this is going to be a daily evening event. Please tell all your friends and please be part of our WhatsApp study group. Call our helpline. नीचे दिया गया है helpline का number. So that before start of the session, we will shoot out for all of you. And every day you have 500 rupees winner's top prize. Now, question number 35. Weight of the lungs compared to the weight of the body, उस टेस्ट को क्या बोलते हैं? If you want to know the death by drowning, weight of the lungs compared to weight of the body, उसका नाम क्या होता है? अंग्रेजी वालों का नाम. Wow, it's called Plotwitz test is what you need to basically remember. It's all a question of Plotwitz कौन है, Reading कौन है. Until entrance is over, we have to mug and keep these things in mind, right? Now, question number 36. FG, FFG, triple FG, ये सब क्या होता है? G, किसका नाम है? किसका नोमेनक्लेचर होता है? ये सब FG, FFG, triple FG. वाओ, गन पाउडर में पाउडर ग्रैन्यूल के साइज के बारे में बात होता है. ये सब चीजें. That's good. Saran, Shardul, Shikhar, SP. Question number 37. What are the contraindications of the gastric lavage? Oh, this is a fundamental question, doctor. Come on, punch your answers. Gastric lavage is contraindicated. Beautiful. In organic kerosene-like poisoning, it is contraindicated. Good to see 34 online players. Excellent, doctor. So remember, 999 रुपीस में आपको नीट पीजी कोचिंग मिलेगा इंकस ऐप के ऊपर. Hardly ₹1 per day. For 3 years you have the activation. In that you get 800 hours of video content, daily live online class, 60,000 question bank to play like quiz tournaments and know your performance, 35,000 PowerPoint slides of notes, 60 full-scale grant tests along with discussion. Oh my God. Everything just for $9.99. No need of wasting costly coaching programs, plan A, plan B, this, that. That's all nonsense. What you need is East or West, Incus app is the best. And above all, you get wonderful friends to fight with, to chat with, to play with. That's how you become the topper in the NEET PG exam. So tell all your friends, Incus app is cheapest. At the same time, it provides double and triple the quality of any other coaching provider in this world, right? So please download the Incus app, call our helpline, and subscribe yourself for $999 for 3 years activation of both the web-based video library and also app-based video content. Now, doctor, question number 38. Direct hemorrhages. Where do you see direct hemorrhages? Easy question. I think most of you will correctly answer this question. Great. Wonderful, doctor. Typically in the brain, once there is any rise of intracranial pressure, that's good. Saransh is on the top of the game. Question number 39. Measures to decrease laterism. What are the measures to decrease laterism include or except? Yes. Great. So vitamin C prophylaxis, parboiling, and ban of the crop, they're all considered to be the important measures. Question 40. Sputum, if you want to disinfect it, it is disinfected by all these ways, except. So disinfectants is another one of the 953 high-yield topics in the NEET PG exam, doctor. Be very sure about it. Burning, boiling, autoclaving is what you need to remember. Very good. Saransh is on the top. Question number 41. Weakest link in evidence-based medicine. What is the weakest link? There are various ways of, is it personal experience, case report, meta-analysis, randomized control trials, which is an easy question. Yeah. Still you thought case report? No. Personal experiences have no place in evidence-based medicine. Very good to see 35 online players. All of you bring your friends and tell them, भाई यहाँ पूरे भारत में बड़े-बड़े लाजवाब ग्लैडिएटर्स आके कुश्ती में in wrestling competition, all of them will join. बोल के पूरे क्लासमेट्स का ग्रुप को पूरा लाना इस YouTube चैनल को जरा आपके WhatsApp ग्रुप में डाल के शेयर करके प्रमोट करना. Our students are our best brand ambassadors. Every day we will play. Every day there is a cash prize. Every day there is an incentive. Wow! And re-energize yourself. And then go back to the video library on the Incus and start playing the quizzes. There are many more quizzes. Almost 60,000 question bank is being provided for you to play as quiz on the Incus app. Great. Question number 42. Question number 42. How much time happened till now? Regarding epidemiology of HIV, what is wrong? What is false regarding epidemiology of HIV? Great. Pregnant women can pass it on to the children. That's the reason they're also affected. 10% of HIV only progress into the full-blown AIDS. Mother-to-child transmission is about 25%. That's what you need to remember. Question number 43. Highest concentration of HIV. 40 minutes. कहाँ होता है? Highest concentration of HIV. Where is it present? Wow, that's good. It is present in semen, is what you need to remember. So, every day we will take one different theme of the quiz. एक दिन radiology images, एक दिन case study based questions, एक दिन only instruments. Like that, we will take one day only image based questions like that. Hepatitis A, what is true? Regarding hepatitis A. Wow. Basically, it causes a milder pediatric clinical presentation. Good, good. Shikhar Mishra, Sankeet, very good. Sankeet is quickly climbing up the ladder to reach to Shikhar Mishra. Let us see. Question number 45. About Human Development Index main, what are all the components of HDI? Is a very important question. False about HDI. Wow, that's good. It is life expectancy at birth, not IMR, is what you need to remember. Good. How come Shikhar did this wrong? Shardul and Sankeet, oh my God, Sankeet is reaching very close to Shikhar. Good, good. Question number 46. Which vaccination is implicated in intussusception? Intussusception. Easy question. So, these are all Kaun Banega PG Pati program. Wow. OPV is sometimes implicated. You need to remember OPV has something to do with the gut, right? So, Sankeet almost reached the second position. Is there any match fixing between Shikhar and Sankeet? Yes. These are all used in emergency conception. Except what? Emergency में इस्तेमाल नहीं करती. Easy question. Oh, come on. All of you will answer this correctly. Biscuit question है ये. Right. Most of you are right. So, good. Sankeet is still maintaining. Oh my God. Sankeet came on to the top. Shikhar, you still have 25 chances more. About contraception, what is true? About contraception. So can you give combined pills in lactation? Can you give pops? Yes. The whole purpose of progesterone only pills special advantage is they can be given during the lactation is what you need to remember. Oh my God. Shikhar has lost this question. But Anju is also quickly ascending up. And Lahari, Kirtana, SM, Vishnu, Sharma, Ritika, and Pri. You all have answered it correctly. Very good. Now, doctor, we almost reached completion of 2/3 of the game. Eradication का मतलब क्या होता है? Eradication. Is it synonymous with easy question? All of you will answer it correctly. Yay! That's right. So only 4 of you answered correctly. Yeah? Eradication is different from elimination. So question number 50. rat flea bite करे तो क्या ट्रांसमिट होगा? इजी क्वेश्चन. स्पेशली ऑप्शंस पे उतना दम नहीं है. आप जरूर आंसर करेगा करेक्टली. Yes, endemic typhus. So Sankit is on the. Oh my God, Shikhar Mishra, rat flea के बारे में मिस हो गया क्या? I can't believe. Now, question number 51. In Alzheimer's disease, you see all this. In Alzheimer's disease, except that's right. Amyloid angiopathy, neurofibrillary tangles, senile plaques, they're all the classical lesions. Good. Question number 52. Alpha amyloid chain. It is found in all these conditions, except right, not in syphilis. Absolutely. Sankit Kentia is on the top. Question number 53. Hemolytic uremic syndrome. One of the very top high-yield questions. What is except? What is the difference between TTP, thrombotic thrombocytopenic purpura, versus hemolytic uremic syndrome? Only one difference. That's right. Focal neurological deficits है तो वो होता है TTP. Otherwise, cystocytes, that is the fragmented RBCs, thrombocytopenia, microangiopathic hemolytic anemia, they're all the part of the both HUS and also TTP. So TTP में neurological involvement को बोलते हैं Reynolds pentod is what you need to remember. Very good, Sankit. You are really doing good. Massive splenomegaly. All this will lead to it. Easy question. Except massive splenomegaly. Easy question to guess. Mainly by elimination, not by any other way. Right. CML में होता है, CLL में नहीं होता. CLL का प्रेजेंटेशन कैसे होता है? एल्डरली पर्सन कंप्लीट पिक्चर कराने के लिए जाएगा और वहां जब स्मीयर बना रहे, यू विल फाइंड ब्रोकन cells, blood cells. So that is a classical presentation of CLL. Oh, Sankit, जब hematology को गर्मा गर्म पढ़ना है, शिखर भी रॉन्ग किया. Very good. Question number 55. Asbestos exposure. So what does it lead to? Asbestos exposure. So, easy question. Very good. It causes all of them, not only carcinoma larynx, even colon and stomach. Very good. Sankit, Shikhar, Shardul, absolutely right. Question number 56. Turner syndrome. What is it? Turner syndrome. Easy question. I know all of you will answer it correctly. So, lymphedema at birth. What is the location? Lymphedema at birth. Now, question number 57. 30-year-old man with cough, chest pain, X-ray shows bilateral hilar lymphadenopathy, non-cascading granulomas. I know all of you will answer this correctly. First of all, diagnosis क्या है मालूम हो ना? Exact. Right. Erythema nodosum, increased ACE levels, increased liver enzymes, they're all true. Very good. Sankit, Shikhar Mishra, Shardul, Saranj, SM. You all have done it correctly. Absolutely not. Question number 58. High anion gap metabolic acidosis. कौन सा poisoning में होता है? All these poisonings except. Easy question to guess. Very, very easy. Good. Oh my God, 7 of you missed it. Acetazolamide, doctor. Carbonic anhydrase inhibitor होता है acetazolamide. Right? So, good to see 36 players online. So, Saranj, SP, and Kirtana also correctly answered. Sankit also correctly answered. Very good. The last 15 questions false about the diarrhea of small bowel origin versus large bowel origin. What is the false thing out of all this? Yes, doctor. Regarding diarrhea of small bowel origin. Very good. So the pH, WBCs, the volume, they're all different between small bowel versus large bowel. Good. Sankit, Anju also correctly did. Vishnu also. Very good. Very good. Still we have 15 questions to fight. Invasive gastroenteritis, secretory gastroenteritis, osmotic diarrhea, you should know the differences. So all this lead to invasive gastroenteritis, etc. Very, very fundamental question. Whoa, that's good. Salmonella, Campylobacter, hemorrhagic E. coli, they're all basically invasive in nature. So SP answered it fastest out of all. That's where SP is in the second position now. Let us see. Last 15 questions to decide who is going to be the 500 rupees winner. Paytm karo. So you are going to get your prize money. They will immediately do if you send your mobile number to our helpline, the winner. So now, doctor, Raynaud's phenomena. It is female predominant mycoplasma infection you may see, systemic stenosis you may see. They're all true statements. Sankit, clean bound. Shikhar made a right guess. Sanket need to be very careful about Anju, Shikhar, Shardul and SP. Any one of you can attack and take away your 500 rupees top prize. Let's see. Ritan's tired. He can't see, he can't pee, he can't climb. What does it include? Actually includes all except. No, includes, only includes, not except. Urethritis, uveitis, arthritis, not conjunctivitis, cataract or glaucoma, right? Good question. So, good to see 36 players. कल तो मैं कम से कम 500 प्लेयर्स को देखना है इस डेली फाइट में पार्टिसिपेट करने के लिए. क्वेश्चन नंबर 63 about anti-epileptic. What is the wrong statement? Come on, doctor, punch. Valproate, how does it act? Viday, how does it act? Etosuximide, how does it act? Very good. Viday, GABA transaminase inhibitor. Valproate, sodium channel inhibition. So you need to be very sure about. Whoa! Sanket, Shardul, SP, they're all very strong. Now, doctor, last 11 questions going to decide who is going to the winner. Chain Puke Class B. What does it include? Banana. What does it include? Chain Pukes Class B includes, right. Actually, it should be except, that's missing. Sorry about it. APTT is not there, INR is there. Now, that's fine. Actually, question frame mein gadbad hai. Question number 65. Large vessel, small vessel, medium sized vessel. Large vessel disease kaun hota hai? So many times we discussed this, doctor. Vasculitis is one topic. You have to be 100% sure, short question. Kal ke NEET PG mein. Takayasu arthritis, Jain cell arthritis hota hai? Large vessel. Kawasaki, medium vessel. Kawasaki क्या होता है? बाइक होता है ना, वो बड़ा व्हीकल लॉरी के जैसे ना छोटा व्हीकल बाइसिकल के जैसे. Medium level. So medium vessel is Kawasaki. Once more, doctor. Incus app mein jana after this quiz is over. Pick up 10-15 topics in a daily quiz that you need to become better when all your friends are answering it correctly, right? And then go to the video library. You have 800 hours of video content, almost 2000 HD videos on the Incus app. Only 999 rupees, you get 3 years subscription. अगर बीच में सीट आ गया तो आपके जूनियर को दे दो, right? So कभी-कभी विद्या किसी को दान करने से पुण्य मिलता है, right? So that's what. It's only 1 rupee that you require to invest to become the NEET PG topper. You don't need 60,000, 50,000 program, plan A, plan B, and all these plans. There's only one plan of becoming topper, and that happens on the Incus app. So, Dr. Sanket versus SP versus Shikhar Mishra. There is a strong fight. The last 9 questions to decide who is going to be the Ajka NEET PG topper. Venous thrombosis is precipitated by all this except. So there is arterial thrombosis, venous thrombosis, both the types of thrombosis. You should know what are the causes for each of them. Easy question. Bernard Solieri's bleeding diathesis. Very good. Oh my God, Sanket did this wrong. Very important wrong. SP is about to capture one more mistake. Sanket, you are going to lose the 500 rupees. 8 questions left over. With regard to the diabetes, what is wrong? Diabetes. Oh, easy question. All of you will answer this correctly. Diabetes. Wow, that's right. It is not 100% for IDDM, it is for NIDDM. Very good. Oh my God, Sankeet, SP, both of them clean board. Shikhar Mishra did it correctly. He is coming very close. Last 7 questions. Who is the winner of rupees 500 tonight? Toffee in gouge is seen in all this except, come on, punch, punch, punch. Toffee in gouge except. कहाँ नहीं होगा? Easy question. Hey, that's right. कभी सुना क्या लिवर में टॉफाई होता? बोले कि नहीं है. स्किन में होता, साइनोवियम में होता, किडनी में होता, लिवर में नहीं होगा. Oh, doctor. Sankeet is right. He gave a punch back to SP and Shikhar Mishra. Very good. Shardul did it correctly. Lahari also did it good. Vikram, SM, Dr. Kaus, Ritika, very good. Last 6 questions to decide who is the winner of rupees 500 of tonight. NEET PG Pati. Extra adrenal pheochromocytoma. What is the most common investigation? Punch, 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 doctor. Extra adrenal pheo. Whoa. It is the MIBT for extra adrenal. Adrenal pheo had to CT scan. That is there. Great. SP reaches almost close, ready to catch Sankeet. So let us see who is going to the winner. Last 5 questions. Punch in answer, doctor. Class 5 kidney lesion. SLE classification में class 5 क्या होता है? Wow, this is a interesting question. Name who is going to be right? Tomorrow's nephrologist कौन है आप में? Oh, 6 of you are right. Membranous glomerulonephritis, that is Sankeet, Shardul, both of them are right. Come on, let us see, doctor. Last 5 questions. Who is going to become the winner of the 500 rupees cash prize? Right away, hot cash sent across to you. Mainly to encourage you to study. To study you require motivation. कोई आके पकड़ के खिलाना है आपको. Come on, you are born to be winner बोल के. That is what Incus app will do. Please subscribe to the Incus app. 999 rupees में 3 साल आपको activation मिल जाएगा instantly. Just for 999 rupees. We give you a program which is worth of about 1 lakh rupees or 2 lakh rupees outside for just 999 rupees. We want entire India to be on Incus app if you are a medical student. So, doctor, let us see. SP, Shardul, Shikhar. Very close. Sankeet, need to be careful. One more mistake, SP will jump and take the 500 bucks. Let's see, last 3 questions. Benz-Jones protein. What is true about Benz-Jones protein? Come on, punch, punch, punch. Will it dissolve at 100? Will it reappear at 100? Benz-Jones protein. Or light chain or heavy chain? Yeah, only 3 of you are right. It dissolves at 100 degrees. Oh my God. SP is on the top. Let's see. 2 more questions. Sankeet can get back his kingdom of Delhi Sultanate. Delhi Sultanate को फिर संकेत ने Will he achieve or not? Let us see. Good. Anju did it right. Great, Anju. Wonderful, wonderful performance. Dr. Kaus also is right. Very good. Last 3 questions. Botulinum toxin. What is wrong about botulinum toxin? Oh! What is botulinum toxin? Wrong about botulinum toxin. How does it act? Right. 6 of you are right. The most effective treatment of choice for the botulinum toxin, how does it interfere? It's acetylcholine release, that's also true, right? So, Dr. SP Shikhar, Sankeet is pushed down. Oh my God. Still 3 questions are there. Let us see. 74th question. Come on, Doctor. Interferon. Where do you use it? Interferon. Where do you use it? Wow. Come on, come on, come on, Doctor. Interferon. Wow. In fact, all of them. A good number of you correctly answered without any second thought. But whoever answers fast will score high. Oh, SP is on the top. Sankeet almost reached. Followed by Shardul. Real NEET PG exam also a excitement with that. That is why I want all of you to play everyday quiz. Push your adrenaline to the same level as the real exam you are facing. This can't be replaced by any other mock test में उतना excitement नहीं मिलता. But real time when you are punching with others and playing in real time, that's how you get that habit of working under pressure in the real exam scenario tomorrow. Last question to decide. Kaun banega 500 rupees cash prize winner? Interferon gamma. What is true? Interferon gamma. Yes, 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 yes. Oh. Right. So you should be very sure what is the effect of it on osteoclast. Will it be used? Is it the gamma or alpha in the multiple sclerosis? Everything you should know. SP is on the top. Very good, SP. Please take a screenshot which is there on your mobile and WhatsApp the image of that to our helpline. Instantly you get 500 rupees cash prize. मजा आ गया ना? फिर कल मिलेंगे, कल फाइट करेंगे, कल के एग्जाम में हम सर्जरी का क्वेश्चंस ले लेंगे, right? So prepare well and then participate, and thank you all for taking participation in this wonderful evening. And even Vikram and Sankeet, who are kind enough to join this broadcast, and the real pleasure. And Balakrishna is saying, sir, this kind of questions like single line is not asked. We'll practice clinical vignettes. Definitely, doctor. If you in fact can follow the previous our broadcast, we have NEET PG toppers. We have the top medical teachers. We have a discussion session on various clinical vignette based questions. One of the days we will have clinical vignettes. One of the days we will have image based. We will change the theme. But thank you so much for joining the session, and we will once more meet tomorrow. And don't forget to share this channel, subscribe, like this YouTube channel, and share it with all your friends. Thank you very much.